Everyone, Lisa White with IVF Manifesting a Miracle here for another clinical conversation with Dr. Green. How you doing, Dr. Green?
I'm doing great. How are you today?
Good. This is our first clinical conversation of 2022.
That's true.
Oh my goodness. So yes, I wanted to have a chat with you about Omicron.
Yeah, well, it's the elephant in the room. If we don't talk about it, that only makes it worse. So I think that's an excellent topic, because one of the things that's interesting, Lisa, is that the science is teaching us more and more each day, if not each week. And the point is that what we believe is happening right now is that this virus, called SARS-CoV-2, which is the name of the original virus, is shifting from being a pandemic, which is this brand new infection that's never been in humans before, that's making people very sick, to being something that's more of an endemic. An endemic are things that you're very familiar with, like, the flu and even the common cold. In fact, when you think of the seasonal head cold that people get, there's, several different viruses that contribute to the seasonal, head cold. And 4 of those are previous coronaviruses. And there's evidence that this new shift to this Omicron variant may be the evolution of this virus and becoming something that is more endemic, that we're going to just see flare up and go quiet from time to time, just like we see with seasonal colds.
Yeah, it's just a really unpredictable time, and everyone's lives are being affected, especially those going through fertility treatments. You add on this pandemic, epidemic, all the things we're going through on top of wanting to conceive and have a baby.
Yeah, and it can be so frustrating, and it can be so scary.
Yeah.
And I think we have to be sensitive to that. And the problem is that this is a virus that 2 years ago didn't even exist in humans. And so we at first knew nothing about it. And that was even scarier. Now we've got so much data coming out so quickly, as well as we have the resources that the top experts everywhere are studying this, and we are learning as we go along. And one of the things that I think a lot of people don't fully appreciate about science, which is very, very relevant in our field of fertility, is that as we get smarter and as we get more experience, we get better and better at what we do. And that's true in both the fertility field, and I'm almost at the point of starting my 27th year in this specialty. And I could tell you, we do things so differently now than we even did 3 or 4 years ago, that it's vastly improved from when I first started 27 years ago. And in many ways, with the coronavirus, we're getting a tremendous upsurge of data, only concentrated into a very small window of time of less than 2 years.
So yeah, because you're the data guy, the science-driven guy, what can you share with us about how it's impacting fertility treatments today? It could be your clinic or in general that you're seeing.
Yeah, and again, this is very current. So, we're recording this in January of 2022. So the data could evolve, but based on what we're currently seeing, several key points. Number one, this Omicron variant is not as severe or as deadly as previous variants. Okay, that people are catching it easier, so it's more infectious, but it also tends to be less dangerous when it is caught. Number two, people with a previous vaccination are very well protected, in the sense that they're not prevented from getting an infection, but the risk of hospitalization is dramatically reduced. Okay. So, we are still very much advocating for vaccination for people that have not vaccinated, especially for anyone that wants to get pregnant, whether they want to get pregnant naturally or whether they want to get pregnant through fertility treatment. And that's because a woman's body responds differently to viruses during pregnancy than the same person if she would catch a virus when she's not pregnant. And this is why even viruses like chickenpox or Zika virus that don't cause much of a serious illness in non-pregnant women can have devastating consequences if someone gets their first exposure during pregnancy. We've seen multitudes of pregnant women that have died this year during pregnancy simply because they were not vaccinated. Last records from the CDC suggested over 90 women have died this year alone. I'm sorry, that'd be 2021.
2021.
So last year, due to a cause that may have been preventable by vaccination. So again, vaccination may not prevent people from catching Omicron, but it can dramatically reduce the risk of severe illness. We're also finding locally here in Denver, the high risk OB group is telling us they're finding an increased risk of third trimester complications in women that are first infected with COVID during pregnancy. And again, this is primarily the unvaccinated. They're seeing problems with stillbirths as well as with bleeding disorders in third trimester infections. So even though the Omicron variant seems less severe to most people that get it, we are still recommending vaccination for our patients to try to prevent problems down the line. That's the third point. The fourth one is, we are really focusing our recommendations for testing for COVID in people that are symptomatic. And the point is if somebody is asymptomatic, even though they might be passing the virus, that doesn't mean that they need to take any special precautions in terms of trying to delay any fertility treatment. But anybody that's symptomatic, whether they're symptomatic from the flu or symptomatic from COVID-19 or symptomatic from bronchitis, anyone that has symptoms should probably consider delaying fertility treatment according to what their center is recommending. And since COVID is a testable thing, it's worthwhile to consider doing a test.
If you can find a test these days.
If you can find a test, exactly. And the last point that I would want to make, that would be number 5, is that even though the Omicron variant seems to be less severe, not everybody that's getting infected right now is getting Omicron. There are still people that are getting infected with Delta variant and others. So we are recommending people be cautious regarding, social distancing and masking if they choose to, just because, you might actually catch COVID and it still might be one of the more severe forms, that it's not all Omicron that's going around, but that's the one that is contributing most to the infections that you're hearing about on the news these days.
It's just hard to believe what we're living through right now. It just seems like everyone is getting COVID. It's just more of a thing. Do you think everyone eventually may get this?
Yeah. And just if we had a way of testing for the common cold, we probably would find everybody has had the cold. Just like if you've lived long enough, you've had the flu at least once. And that's the difference between an infection that's endemic versus one that's a pandemic. The other important point of endemic infections is just like the flu, sometimes even if you've been vaccinated, you might need a vaccination again later. Just like with the chicken pox. Someone that had chicken pox as a child is recommended to get vaccinated against chicken pox again before pregnancy. And again, this is why a lot of people think it's an either or discussion about vaccination versus treatment versus pregnancy. And sometimes the answers are much more nuanced. And one of the things that I think is so sad that's going on so much today is that we've lost the ability to discuss things and to share facts. And, one of the things I love about science that I embrace so much is that we can debate things. I can put my data on the table and you can put your data on the table, and together we could try to come up with an answer that explains all the facts. But today, especially when it comes to things like COVID, we often say, well, here's what the data shows. And then someone crosses their arms and says, but here's what I believe. And it's like, that's not what a scientific debate is about. You should do what you believe. and I mean this, everybody should do what they believe, but hopefully they should be open-minded enough to looking at the data, because sometimes with better data, your beliefs may evolve, and give yourself that leeway.
Do you see a point where it would ever be required to be vaccinated to go through fertility treatments or any of that?
No, just like it's not required for people to get vaccinated against rubella or chickenpox, but it is recommended.
Mhm.
Because again, if a woman is not rubella immune, and anyone that's been to an OB is probably, if they've been pregnant, then they know that their rubella vaccination status has been tested, is that rubella has devastating effects on babies. And
Mhm.
so if a woman is not immune and gets pregnant, she could have a child with a lifelong problem that could have been prevented. So there's a difference between a recommendation and a mandate. And just like we don't have mandates for rubella or for polio or for chickenpox, it is a recommendation.
And for this topic, since we're talking about Omicron, what symptoms are you seeing with that?
It's variable, but you know, Omicron, part of why, and if you don't mind me digging into the science a little bit,
Yeah.
part of what we see is that Omicron is not as good at affecting the deep tissue of the lungs, what's called the alveoli.
Yep.
Now, keep in mind, when the alveoli are infected, that's what creates pneumonia, okay?
Mhm.
Instead, Omicron is more effective kind of from the neck up in
Mm.
affecting the upper airway. You
Okay.
know, so you're far more likely to experience things like sore throat, nasal symptoms, whether it's lack of taste or sense of smell, coughing, sneezing, things like that. And it's because it infects the upper airways easier. That's what makes it easier to transmit.
Mm.
And that also is what makes it less deadly, because it's not as effective in the deep tissues of the lungs. And that's why we're seeing a shift in both symptoms as well as how infectious this is, because it still is infecting the same neighborhood, but it's concentrating in a different region, the upper airways instead of the lower airways. Does that make sense?
Yes. And like, so when you're getting tested for this,
Mhm.
you have to find the specific test for Omicron, correct?
Yeah, well, and this is again another place where the research is evolving. So again, this is mid-January, but what we're finding is that with the older variants, it was more accurate to do a nasal test than a saliva test. But
Yeah.
some of the newer data is suggesting that with Omicron, saliva may be more accurate than nasal.
Yeah, the back of the throat, right? Or no?
Well,
Or
even just the saliva, and that's why I'm saying
Mhm.
that the tests are probably going to be evolving, just like the virus is evolving. And again, this doesn't mean the old tests are bad. It just
Yeah.
means they're better at detecting the older strains.
So is there like a resource people should go to that you recommend? Like if you want to get some clarity on
Well, unfortunately, you know,
so much
there's not.
information out there.
There's a tremendous amount, and the best resource that I could offer is that people could continue to follow us. As
Yeah.
you know, we continue to update. I believe this is maybe the fourth or fifth time that we've discussed COVID.
Or at
You
least
know,
probably
and
like
and
six.
so we keep trying. And the point is we're trying to tailor our advice to our audience, which
Yeah.
are reproductive age women.
Mhm.
Now, someone that's immunocompromised, they should talk to their doctor.
Right. That's
Someone
a
that
good
is
point to
elderly, they should
specify.
talk to their doctor,
Yeah.
you know? And the advice is not going to be universal, because, you know, as report endemic versus pandemic, there are people that can die from the common cold, you
Mhm.
know, and they need to follow the advice of their doctors. But we're trying to target our advice to our audience, which is
Yeah.
reproductive age people. And currently, because the testing is a little bit vague, you
Mhm.
know, that we don't know if a positive is a true positive, I mean, is a false negative. This is why I'm saying the testing, I'm only recommending if people are symptomatic.
Mhm.
But I am recommending that people use, you know, good judgment and caution to try to prevent themselves from getting infected.
Yeah.
Because if they get infected and they become symptomatic, they might need to delay treatment.
And silly question, but can symptoms show up and then days later you get the positive, or should you, I mean, if you're feeling it? you're symptomatic, obviously, but
Well, like I said, if someone's symptomatic, then they probably shouldn't be doing treatment, because imagine someone is symptomatic, has a fever, they get a negative COVID test. That doesn't mean they don't have flu, and we
mm,
don't want them spreading flu in the waiting room into everyone else either. You know what I mean? And
yeah,
so the point is that if someone's sick, it's probably not the best time to be doing fertility treatment.
yeah,
And people used to, tough it up and go to work sick and whatnot, but with more options for remote learning, I think, we're doing ourselves a favor, as well as doing a favor of everyone else around us, including the
yeah,
workers and the
yeah.
other people we're shopping with, if we stay home if we're sick.
And I appreciate you being on the front lines. You can't really do your job from from home. There's no
No,
way.
and honestly, I miss the days when I used to be able to hug it out with people or hold their
Yeah,
babies, but I
yeah.
had someone bring in a beautiful set of twins yesterday, and we took a picture, and I kind of stood off to the side and they stood off to the other side, and we all had our masks on, but we were
Wow.
all smiling with our eyes. And we grow and we adapt, and things are going to ultimately
Mhm.
hit a new normal, and we'll adapt and we'll move
Yeah, we
forward.
adapt, we
And
adapt and take care of ourselves, right? We just have to
other than
optimize our
that, let's still be friends and love each other. Let's not be so divisive just because
yeah,
we don't want to do this and they chose to do that. Let's
right.
accept each other's decisions and then just make accommodations so that we don't
Mhm.
breach each other's preferences.
Yeah, exactly. Yeah. And if anyone is interested in learning some of the recommendations you give to optimize kind of your immune system, we've talked about that in the past. Really good tips you've given. So check back
Yeah. And those
those
tips are
videos.
still considered active for every respiratory infection.
Mm,
Things like, use of melatonin, keeping your vitamin D level in a range of 40 to 60, including, a small amount of zinc supplementation. And the reason I say that is sometimes people go too deeply into, overusing supplements, and that can cause complications too.
What did you say about melatonin? Remind me of that one.
Yeah, melatonin, which is a hormone that's naturally released during sleep,
Hmm.
has been shown to help bolster the immune system.
Okay.
And the problem is, the only way someone could accurately measure your melatonin level would be to come to your house and wake you up at about 2:30 in the morning and measure your level, because by the time you would wake up and go to a lab, the levels have dropped down.
Oh,
No,
interesting.
but what that hormone signal is doing during sleep is it's helping your immune system learn what it could from the day before and take some preparations as it can for the day to come. And so it kind of signals the immune system. This is that time of day that, we're kind of processing information and then getting ready for how we want to approach the new day.
Okay.
And even if someone thinks they're sleeping well, they might not be releasing good melatonin levels. So
Hmm. So much information.
absolutely. And again, that's the beauty of science, Lisa, is that
Yeah.
anytime someone says, I don't believe, it's like, well, let's sit down. I'm happy to review the data with you and see if your beliefs evolve.
Yeah. Well, I hear a 4-year-old in the background. We're quarantining as we speak.
Well,
Got the call from school. Got to bring her home. Class exposure to COVID. So I'm living it. I'm going to have to go. But I
yeah,
know you have a patient too. So I just want to thank you so much for these wonderful chats.
absolutely. You have a happy day, and
Thank
let's
you.
keep evolving, and let's just evolve faster than this virus does.
Yes, connect with us. I have my YouTube channel, Lisa White, IVF Manifesting a Miracle, and I'm at my website, IVF Manifesting a Miracle. You're at enhancingfertility.com. So thank you so much, Dr. Green.
Have a great day.
You too. Talk soon. Bye-bye.
Bye.